What I want to talk to you about now is our out-of-control pension system in New Jersey and our out-of-control health care benefit system for public employees in New Jersey. Let me first, before I talk about what our ideas are to solve this, let me put it in the context for you first, the size of the problem. The underfunding in the pension system as we stand here today for state and local government in New Jersey is conservative $46 billion. $46 billion underfunded, given the promises and obligations that previous governments have made to public employees in New Jersey. The system is broke. Are we making pension payments to people who are collecting pensions today? Of course we are. Will we be able to do that for a period of time going forward? Absolutely. And the system may not go broke if we did nothing, even during the time that I'm governor, if that's for another 3 years or for another 7 years. But it will continue to affect our ability to fund other programs in the state to provide tax relief, because it will continue to eat more and more of our budget, and we'll be losing ground the entire time. I say to many public employees who argue with me about proposals like the ones I'm going to make and others, that you may hate me now, but 8, 9, 10 years from now, you're going to look back and say that it was this governor that saved your pension, that gave you an opportunity to have retirement income, rather than just sang a happy tune, got myself through a couple of elections and rode off into retirement, and left an even worse mess than the one I inherited for whoever the next man or woman is who takes this job. So, here are some of the ideas. In 2001, without real explanation, and in my view, without any real common sense, the Republicans that controlled the state legislature at that time, along with an acting Republican governor, passed a 9% increase in the pension benefits for public employees, with no way to pay for it. During the go-go days of that time, when the stock market was flying, everybody thought that things were going to last like that forever. They passed a 9% increase that had no basis in fact and was not negotiated. It was passed by the legislature and bestowed upon the special interests who represent public employees. It makes no sense. And so we propose, as the beginning of reforming this system, to take that away. There was no rationale for it in the first place. And while we can't take away that 9% that those folks have accumulated over the last 10 years, it's vested, they now have it, you can't take it from them. What we're saying is, no more. Go back to the original pension calculation and get rid of that 9% increase. It made no sense to us. As to the public employees and the teachers with less than 25 years of service. Now, let me tell you, the reason we focus on less than 25 years of service is because there's a body of law out there that right now, all the benefits you get for a pension fully vest, they become fully yours at 25 years of service. And so to change the rules of the game for anybody who's now over 25 years would be like going into their bank account and stealing money from them. We're not going to do that. But there's significant reform and change that could happen for people less than 25 years, which is really the majority of people in the system that we can do. So when I talk about these will be, all these reforms are about people with less than 25 years of service. First, we have to bring the retirement age uniformly up to 65. It's less than that now. We need to bring it uniformly to 65. Second, right now, you can be eligible for early retirement after 25 years of service. We need to raise that to 30 years of service. We can no longer sustain people working for just 25 years and being eligible for early retirement. We need to raise that from 25 to 30, the same way we need to raise the retirement age, both for early retirement eligibility and for normal retirement, to 65. So we need to deal a little bit differently with law enforcement. And so our proposal on law enforcement is this. It changes, right now, if you have 25 years of service in law enforcement, you can retire regardless of age at 65% of your final salary. We believe now that if you're going to retire with 65%, we have to move that up to 30 years for 25 years. And that if you decide to go at 25 years, that you need to go down from 65% to 60%. And this is just a bow to the financial situation that we all find ourselves in. It still gives police officers the opportunity to retire at a substantial pension. Now, there are some things that would apply to all of the systems. Right now, all the systems have different levels of employee contribution. From the judges, who contribute only 3% of salary to their pension, to the police and fire, who contribute 8.5% of their salary, the teachers and the other public workers, who contribute 5.5% of salary to their pension, and the state police, who contribute 7.5% of their salary. What we're proposing here is that everyone contribute the same, that we bring everyone up to 8.5%. Lastly, understand that if we take this number out even further, if we don't do these things, let me tell you, none of these things that I'm proposing is going to be a picnic to get through the state legislature. You can be sure that every special interest public sector union who cares only about themselves and isn't caring about the better and greater general public will stand up against that. You're going to be able to judge who's really standing up for the public or not based upon how they react to this. Because as I'm laying these things out for you, I see a lot of nodding heads in the audience. This is not hard stuff to understand. What we are going to propose is that for all active employees, we transition between now and 2014, so over the next 4 years, we transition to a system where the employer pays 70% of the cost of health insurance and the employee pays 30% of the cost of that coverage. Second, we should switch to a system which is used by the federal government and almost all states. 47 of the 50 states and the federal government use a system where the employee pays a percentage of the premium rather than a percentage of their salary. And we need to make sure that all of these changes deal with things like co-pays and the other things, and they also deal with health benefits for retirees. Because understand something, our health benefit plan right now is underfunded at $67 billion. $67 billion. Without this type of immediate action, costs are going to increase by more than 40% over the next 4 years. And that cost will be passed on to you. There's no one else to pay for it if we don't have employees start stepping up to the plate and paying for themselves.